Infection after joint replacement surgery is a devastating complication. We try very hard to decrease the risk of infection. However, if an infection occurs after hip or knee replacement surgery, we have to surgically treat the infection. If it happens in the early post-operative period, only removal of the plastic and replacing it after cleaning the joint suffices. However, if the infection is a chronic infection, which means that the infection is on for a very long time, then we need to actually remove the artificial part and clean out the bone. Keep an antibiotic spacer in the joint for about 6 weeks, remove the antibiotic spacer and then put in another revision implant. This is a two-staged surgery for treating infection of artificial hip and knee implants.